Hi, everyone. Welcome to Dean's Chat, where we talk about all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host for the Dean's Chat podcast. Today, we have a special bonus episode, and I'm going to be bringing in future leaders in podiatric medicine. And I'm so proud to introduce two residents, both who graduated from the Samuel Merritt College of Podiatric Medicine in 2022. They are currently first-year residents. Rahul Mishra is at Beth Israel Deaconess Medical Center. Rahul, welcome.
Thank you, Dr. Jensen.
Shalvi Prasad is also 2022 graduate from Samuel Merritt College of Podiatric Medicine, and she's currently at the VA New Mexico Veteran Affairs, and also they have a relationship with Kaiser Health Foundation. So welcome to Dean's Chat.
Thank you, Dr. Jensen.
Thank you for having us.
You know, this is the first time I've done Dean's Chat with students and residents that weren't affiliated with my college at Arizona. So I'm really excited about having you on the show, and I appreciate you making time to do it.
Of course. Really excited to be here. Thank you so much for the intro.
As I mentioned earlier, the California College of Podiatric Medicine back in the day was my alma mater. So I always have warm feelings about the Bay Area. So I can't wait to hear more about your college and things that you were doing as you prepared to go into residency. So to get started, what I thought we'd do is I'd love for you to give us a little bit of history about your academic background and how you got onto your journey for podiatric medicine, and then we'll take it from there. Shalvi, would you like to go first?
Yeah, I'd be happy to. Thank you again for having us on. But as far as my journey, so I'm a first-gen college student. So kind of navigated through that pathway on my own. Didn't really know much about the pathway to going into medical school. So all I knew starting off was just the MD route. And I got into college and learned that there was a DO route. And those were kind of the only two that I knew about. And it wasn't until I graduated and one of the jobs I had about 2 years of a gap year. I was a pre-health advisor. So I had to advise for all of the health professions. And that's when I first learned about podiatric medicine. And I became very interested in it because I felt like it gave me all of those different things that I wanted when it came to a career in medicine and being hands-on and being able to do surgery and just all of the things that I wanted to do. And so I began shadowing a local podiatrist. I loved everything I wanted to do in my future, and the rest is history, and I haven't regretted it since.
So who did you have the opportunity to shadow?
I was with Dr. Basso in Davis.
Very good. I think the Basso family they've got generations of podiatrists, if I'm not mistaken, because I used to work with them back when I was a student.
Yes. Yeah. That was the one thing I asked him. I was like, how did you find out? And he goes, I come from a family of podiatrists. I was like, okay, well, that makes sense.
It's truly amazing how it's a small world. So what were you doing between the 2 years between when you graduated and you went into podiatric medical school?
Yeah, I probably had, 5 or 6 jobs. So I was just working a bunch and I used that time to pay off my loans. But I was a substitute teacher. I worked at a local nonprofit. They did legislative health policy work. As a pre-health advisor, I was an ER scribe. So kind of just wearing a lot of different hats and just, having fun. And I traveled during that time too. So it was a good time, good gap years.
That's a great story. Thank you. Rahul, how about you? How did you find out about podiatric medicine, and maybe give us a little background on your academic journey?
Sure. Yeah. I'd like to just say quickly, I'm really glad Shalvi found podiatry because I think she's a great advocate for our field. And I think she's going to do great things in the future after residency. But in terms of my career path, I grew up in the Bay Area as well. But I wanted to kind of get out of the Bay Area. So I went to school over at the University of Michigan, Ann Arbor. Over there, I think my main goal was to kind of get into orthopedics or sports medicine. I did my undergrad in kinesiology and movement science, to be specific. And then around my senior year, after I'd taken the MCAT and everything, I realized that one of my friends from high school was at CSPM, now Samuel Merritt School of Pediatric Medicine. And I kind of reached out to her. I was like, hey, what is this podiatry thing about? And she kind of, gave me the rundown about like what it entails, the residency process, school, everything. And then I was fortunate enough that Michigan actually has a fellowship on their campus is a diabetic research fellowship. So I reached out to them, Dr. Munson to be exact, and I was like, hey, can I shadow you for a few weeks just to see what this podiatry thing is about? And I got to shadow him. I think Dr. Holmes is there as well, and they were fantastic people. I felt like their quality of life was fascinating to me. It was the surgery that they got to do, the diabetic limb salvage, I think, was the most interesting to me because I come from a family who everybody has diabetes. I think going into undergrad, I was like, hey, I want to do sports medicine, I want to do ortho. But when I started learning more about diabetes, how it can ravage someone's life and how podiatrists can step in and kind of help kind of guide them through the entire process and maybe even save limbs. That was fascinating to me. And I think that's where I kind of fell in love with the field of podiatry. I applied to all the schools. I got an interview at CSPM and I got the opportunity to come back home to the Bay Area. So I was like, hey, why not? And that was it. And since then, I haven't regretted my decision. I'm very fortunate enough to be able to be at this residency, BIDMC, with Dr. Rosenblum and everybody else. And I'm loving every day of it.
Well, that's fantastic. We were very fortunate to be able to shadow at the University of Michigan. I know Gary Rothenberg real well.
Yes.
Just a phenomenal group. So that's great. And then who wouldn't want to spend 4 years in the Bay Area, right? I think it's interesting that the school's over at Samuel Merritt, because when I was at the time was the California College of Podiatric Medicine, it was down in San Francisco off Scott and Eddy, right off the Visadero there. But we used to always go over to Lake Merritt and run. They had 5Ks would be one route lap around the lake, or a 10K would be 2 laps. So I'm very familiar with right where you're at for school, and that's great. Let's talk about the California School of Podiatric Medicine with Samuel Merritt. So when you made the decision to go there, I imagine you two met the first day of class, huh?
Yeah.
Well, that's great. Let's talk about the educational experience. And one of my goals in doing this podcast is that if prospective students are looking at going into podiatric medicine, I would love for them to have an opportunity to listen to younger students and residents that are pursuing podiatric medicine, so they can get a firsthand view of what they're going to be in for. I'll never forget my first day of class at California. Dr. Kriz was teaching lower extremity anatomy, and she said, "Okay, the party's over. It's time to get to work." So I know it's a long haul, right? It's 4 years, but if you wouldn't mind sharing, you can just kind of talk together on it about what it was like, especially in the first couple of years, which are, basic science heavy. And then we can talk about other things about the college as we go. But Rahul, would you mind starting?
Yeah, for sure. I think in terms of the academic track at CSPM and specifically CSPM, we start clinics in our second year. So we do basic science the first 2 years. You do physiology, histology, anatomy, microbiology, everything. And then in your second year, we actually start kind of rotating through several clinics through the Bay Area, the San Francisco General, Highland Hospital, which is in Oakland. So we get hands-on experience quite early on. So I would say you become pretty strong clinically compared to some other schools maybe that start a little bit later and they don't get as much exposure that we do. So coming into third year, you're already a little bit more comfortable interviewing the patient, comfortable presenting your patient, and kind of coming up with a plan so that in your fourth year, when you're extern over at the residency programs, you can really shine, and kind of display your skills clinically. I think in terms of like how the transition is from being an undergrad student to a medical student, it's not as much of a transition as it is compared to going from medical school to residency, because undergrad you're studying and then medical school you're also studying. So as long as you figure out what works for you best, how you study, and you don't change that, I think you will succeed in medical school. When people start to change the way they study, try experimenting, that's where they kind of fall into a hole, because like they say, it's like drinking from a fire hydrant, and you don't have the time to experiment how to study. I think that's something you should figure out early on before you start school, and kind of stay constant. And I think that's the recipe for success. For me personally, I study more so by myself. I go to class to kind of ask questions and kind of think freely. Whereas other students might want to go to class, and that's where learn the best. They don't learn as well sitting by themselves, kind of reading notes. So it really depends on the individual. And I think once you figure out what works best for you, I think you will succeed.
I agree. And when I interface with our students, I always tell them it's normal to have some free-floating anxiety to whether they're ready for the academic challenge at hand. But you're right. They do find their path. Shalvi, what was your experience coming into the California college and school, and how did that play out for you, especially the first 2 years leading up to we all have to take Part 1 boards, and that's a big hurdle in our profession. So how did that work for you?
Yeah, so I mean, one of the reasons I decided to go to CSPM was because they had a small class size. And that's something that I realized, pretty early on when I went to UC Davis. I was in classes where there would be like 300 students, 500 students. And it was just really hard to really speak with the professors and really get a hold on the material. And I found that if I was in a smaller class size, I felt more comfortable asking questions. We had an open door policy. So just going up to the professors and asking questions, maybe if it wasn't even in class, after class. And I think that's something that really helped me. I was able to, like Rahul, I do like studying on my own, but I did go to class every day. Up until COVID hit. So that was another thing I think our class had to go through, which I think, it was pros and cons because most of that hit during our didactic time. So we still were able to get a lot of that course content, which was good. And the hands-on piece we did get earlier. So we did start that during our second year, which I think extremely helped us out. But I mean, I think as far as studying and the school goes and boards, a lot of that for me was just engaging with the material. And the more I was able to see it and the more I was able to do it, it helped me solidify that material and just build on that foundation that has only grown. So the more I saw the material, the more I was able to work with it, the more I was able to do that with the different patients and see the pathology working. That's kind of what helped everything stick for me. So I'm a very hands-on person. I do like to talk and speak my mind. And I think we're able to go across that hurdle by having the Zoom and having these platforms that allowed us to still study on our own, get the material, get the information, and yes, apply it in clinic. But in cases where we weren't able to do that, it also helped me to talk about the material in a group and really ask questions to really see, do I understand it or does it make sense? Because sometimes you don't know when you go to explain it. And so it's a good reality check and it helps things stick better.
I think I got to add on to what Shalvi said in terms of hands-on learning. I also like to learn more hands-on than trying to read. So I think for me, cadaver labs were like an amazing resource for us. I feel bad for some of the students that went through COVID after us that weren't able to have that access to cadaver labs as freely because we're a surgical field, anatomy is very important, and being able to know every single nerve, every single vessel in the foot, lower limb, every single ligament. I think that's very important for our field in the future. And even in residency, whenever we have a cadaver lab, I make sure I go, even if I'm off service, make sure I get into the lab with the other residents just to see if I can, try out some techniques or, prepare for some surgeries in the future. So I think making use of the cadaver lab, if you have one at your school, is very important for our field.
Well, there's no doubt, because if you think about it, anatomy is the foundation for everything. Anatomy is the foundation for biomechanics, of knowing the normal, abnormal foot. And of course, really, if you think about it, surgery is nothing more than applied anatomy. So I'm with you. I think I'm totally on board with that. What I wanted to talk about for a couple minutes, there's something that separates our profession from others, and that's biomechanics and the function of the foot. You are you were, when you were in California, were at the mecca of podiatric biomechanics. I've often said that we should have a hall of fame for podiatric biomechanics, because if you think about it, that's where Dr. Root and Dr. Weed started biomechanics. I actually had Dr. Weed as a professor. But if you can go down these names, Dr. Shear, Dr. Valmassi, Dr. Blake, Dr. Kirby, Dr. Levac, Dr. Subotnick, Dr. Pagliano, Dr. Jenkins, Dr. Dutra, Jimmy Ratcliffe was recently president of the Sports Medicine Association. It's amazing, right? And the tentacles that reached out from California are incredible. Whether you're in Miami or you're in Arizona, you're teaching root biomechanics from California. How was your biomechanics experience? Shalvi?
It was great. I mean, we actually were lucky enough to have biomechanics in person, and I had no idea what biomechanics was. I didn't take kinesiology. And so it was a whole nother language. And so I think it was great seeing it firsthand. I mean, when I was reading about it, this is one of those subjects that you just have to see it and you have to see it play out in order for it to make sense. And I still use that. I mean, we cast for orthotics here, and sometimes people come back and things aren't feeling right. And it's being able to make those adjustments. And I feel like I'm only able to do that because I was able to see it. I was able to see the difference. I was able to look at different foot types and what they need. And I think having Dr. Blake come in and teaching us his expertise, what he looks at, and applying all of that. So I think you're right. We do have a very strong biomechanics background from our school.
So Rahul, when you had a background in kinesiology, that must have been a nice segue into podiatric biomechanics. Can you comment on that a little bit?
Exactly. I was going to say, when I was in kinesiology, we did have biomechanics courses each year. That's where I kind of started learning more about biomechanics. And when I was applying for podiatry school, I learned that CSPM was the mecca of biomechanics and podiatry. So I think for me, it was a no-brainer. It was home biomechanics. I'm coming to CSPM. I think, like Shalvi said, I think we had the great opportunity to have biomechanics in person. Dr. Dutra was our teacher for the most part. And he's excellent. Obviously, he used to be the Golden State Warriors podiatrist for a while. So learning from him, learning how to cast orthotics, looking at gait exams. We had a motion sensor lab at Samuel Merritt. So we're able to kind of hang out in there, kind of do a little bit of research maybe, or kind of see how the biomechanics applied in person. I think that was a fantastic resource for us. And like Shalvi said, we use it to this day. And I think we'll continue to use it in our own practice when we finish residency as well.
I think you'll use it for the rest of your career. I mean, really, it's a foundation for surgical planning also. So
Sure.
That's what a great background to have and a foundation going to school there. So let's talk about clerkships. I imagine you both traveled around the country and went to clerkships. Did you both do a clerkship at the residencies you ended up matching at?
Yes.
Yes.
Oh.
Yeah, I actually did my core here. So because we started our clinicals in our second year, if we have the option to do cores outside of the Bay Area. And so I felt like I had about 2 years there and I wanted to go branch out and see kind of how another part of the country might run things. So I actually came here for my core. And so I was here for 4 months out of my fourth year. And then I did externships throughout the country.
Very good. Where all did you have an opportunity to do externships? Because it's a great opportunity to see the way podiatric medicine is practiced around the country.
Exactly. And that's what my goal was. So I actually went down, I had one in California. So I went down to Chino Valley. I was at Maricopa in Phoenix. Then I went to Scott and White in Temple in Texas. And then I was at the VA in Tennessee. So I kind of did go all over the place, and it was a great experience. I would do it all over again because it was good to see how each spot ran their residency program, and they were all very different as well. So some were one resident program, some had a larger group, some had more attendings that they worked with, some had different focuses, some had more peds, some had burn. And so I think my fourth year was a lot of fun. I got to do the traveling, and I also got to do a lot of podiatry and see how the country runs things a little bit differently.
Yeah, it's a great opportunity because you're never going to have that opportunity again. So you got to make the most of it. Rahul, what was your clerkship or externship experience?
Yeah, so Beth Israel was actually my only East Coast program that I rotated through. I went through Chicago as well as a small program called Humboldt Park. I started off in Chino with Shalvi, actually. We had a great time there. It was great to start off the externship journey, having a friend at your externship, because honestly, your co-externs really dictate how your externship goes. Because if you can't really rely on your co-extern or make friends with them, you can have a pretty bad month. But if you have a good friend and everybody is supportive and you have a good time, I think the entire month is good, because clerkships are a stressful time. It's a whole month of basically a mini interview. You're kind of expected to be perfect every single day. And everybody's kind of like looking at you and as a prospective resident. So it's always nice to have a excellent co-extern with you to kind of help move things along. I also ended up clerking at Cedars-Sinai down in Beverly Hills, as well as VA San Francisco, which kind of helped me. So for me, I like to travel the country. I want to see different perspectives. That's why I went to Michigan. I'm from California. I went to the Midwest, and I ended up in the East Coast because I think it's important to have wide perspectives in your practice, because certain things that they do over in the East Coast, they don't do it in the West Coast or the Midwest. Like when I clerked, I saw that they did a lot more Kalish over here, and I didn't see a single Kalish over on the West Coast. So I think for prospective students and students entering clerkships or applying for clerkships, and even if you don't want to end up on the East Coast, I would say rotate there for a month, just to get a wide perspective on like what the field is and how things are done differently coast to coast.
I agree with that. I oftentimes tell my students, and this year our students matched in 18 different states. And so they're going on. But I encourage them to see what our profession has to offer, whether it's Florida or Boston or Washington, Oregon, California, and everywhere in between. So I'm glad you guys did that. I think that's really, really important. Could we spend a couple minutes talking about each of your residency programs? Because I'm sure, we've talked about the school, right? So prospective students want to hear about the schools, but I think it'd be great to also talk about your residency programs, because current students are going to be looking at going to Beth Israel, and they're looking at the VA Albuquerque. Shalvi, do you want to start? Tell us about your program and how it's structured and how many residents you have. The floor is yours.
Yeah, so I love my residency program. We have 4 residents a year. We are joint with the Kaiser Sacramento program. So similar to the Scripps program, they send 2 of their residents during their 3rd year. We send 2 of our residents during our 3rd year to go rotate through Kaiser Sacramento, Roseville, and Morse Avenue. We are a VA, but I think I rotated a few different VAs. Completely forgot to talk about VASF, but Rahul and I actually started our externships together and ended it together too. So yeah, ended with VASF. I think even though it's a VA, we see a wide range of cases and pathology that I think the stigma with VAs is it's a lot of wound care, it's a lot of older patients, and we are very close to an Air Force base. So we see a lot of younger patients as well. And then in addition to that, we also have about over 30 community attendings that we work with. So we rotate through private practices. We have a limb salvage rotation. So I felt that this was a very well-rounded program, not only with the types of residents and attendings that we work with, but the different types of settings that we're in. So I get the VA setting, I get the private practice, and then I'll be able to go back to Kaiser and have that setting as well. So I think it's excellent to get really good hands-on experience and then work with different attendings that have trained at different programs throughout the country. So I think it's very strong in that sense. We get a lot of cases, we get a lot of numbers, and even though it's a VA, I feel like it's not the typical VA. So we have 4 residents here, and then in our 3rd year we'll split. So 2 people will stay here, and then 2 people go to Kaiser. So I'm really excited, and I've not regretted my decision since. So I'm excited to see how things go.
What a phenomenal opportunity. I think that's a trend with the VA programs now, because the VA in LA is now affiliated with UCLA. So you're getting all the great things the VA has to offer with, like you said, working with the outside attendings. And I know in Denver, the Denver VA merged with Denver Health. And one of my old residents, Christine Hoffman, is their new program director. So I think you're going to see more and more of those kind of joint programs together going forward. So tell me about your first year of residency. What's that been like, Shalvi?
It's been a whirlwind, but it's a lot of cases. And I think because I did my core here, the transition actually was not as bad as I thought it would be. So I think I kind of knew how the system worked. I'd work with all the attendings. I had done all the outside rotations with the same different departments. So I think that really helped. So externing at a place that you're going to do residency at, I think is a huge strength. And another thing, I think the hardest part was working with students. So kind of being on the other end, we work very heavily with students, and we have to put together presentations and McGlamory chapter reviews. And I think all of these things really help with the in-training exams and the board exams that we have coming up. But that whole teaching, knowing, do you really know it? Because now you need to teach it to someone. That has been actually a very humbling and fun experience. I think I do love teaching, and I love working with students. And so being able to do that from the other side is a lot of fun. And then just seeing how different attendings do cases, and the more interest you show, being able to do cases from start to finish, and that these are your patients and you need to do what's best for them. And it's just a really humbling experience that I think I've loved. And it's crazy that we're now at the end of our first year, because I feel like we were just starting. So time really does fly by.
Oh, it does for sure. And there's nothing like knowing information than having to teach it, right? So just a little side note, I was a co-founder for the North Colorado residency program, and I was the clerkship director for 10 years. And I had to be on my toes every day because I had these students coming in from all the different schools and colleges of podiatric medicine, and you're all super bright, right? Academically, you're on your game, and you're there to get more clinical opportunities. So I remember when I was teaching and things, it really helped me keep me on my toes, if you will. So that's great. Rahul, tell us about Beth Israel Deaconess Medical Center. What's it like being a resident there? You're in this academic world of Boston. It must be just a phenomenal experience for you.
Yeah. How much time do we have to talk about this? I can go on forever.
Well, we've got lots of time. You go ahead and tell us the story.
Yeah, sure. So we are a Harvard affiliate program. We take 2 residents per year, so 6 total residents. Our first 6 months of the intern year, we're off service quite a bit. We're doing emergency department rotations, internal medicine, radiology, anesthesia. We don't take call for the first 6 months of our intern year, I think, which is fantastic because you get the feel for the system for the first 6 months before you start taking call. We have fantastic attendings here who are, I think, leaders in our field as well. We have Dr. Rosenblum, as you know, Dr. Din, Dr. Marcoux, Dr. Chirini, Dr. Reamer, Dr. Manning now. So we have attendings that we can learn so much from. And I think one of the main important things about going into residency is, well, what do you do after residency? You want to get a job, right? So I think networking is also a huge part of residency. And I think coming to Beth Israel that's one of the main points is you have these attendings that are very well connected throughout the entire country, and they can kind of guide you in terms of your job search, and kind of the name kind of carries. It's like almost like marketing, right? In terms of my first year here, like Shalvi said, it's been a whirlwind. The transition from being a student to a resident is insane. When you're a student, you just show up to the OR, maybe, read about the surgery the night before, but you're a resident. This is your patient, right? You're responsible. The blade's in your hand. You have to make sure you know their labs before they come into the OR, you know their history, you know their biomechanics. And then after the surgery, this is also your patient. When you're on call, you get paged at 1 a.m., 2 a.m. from patients that are, I'm having a lot of pain. I just had a bunion surgery and it hurts. And you have to kind of triage that and kind of figure out what you need to do. And I think that's something that I didn't expect coming into residency. You kind of have to learn, because I think it's great experience, obviously, because when you're out on your own and your patients are, in pain at 2 a.m., you have to figure out what you got to do. And I think this is a great experience here. And like you mentioned, Boston is an academic center. You have MIT, you have Harvard, you have so many great institutions around you. I think it's a fantastic place to be if you're interested in academia. We have a great research fund. So I'm involved in like 4 or 5 papers right now. And I think it's fantastic. I think we can, I want to move the field of podiatry forward. And I think doing research is the way to do it. So having the opportunity to do that, I think is amazing. And Beth is also one of the main hospitals in the country, I would say, in terms of limb salvage. I think the TMA was kind of invented at the Deaconess Hospital by Dr. McKittrick. And since then, we've obviously come a long way since 1944. But I think that the values of limb salvage still play a role. We have a great relationship with our vascular surgery colleagues and our plastic surgery colleagues. So we actually have a vascular surgery resident rotating with us now each year, so that they also kind of get to learn what podiatry is about, learn how to do amputations or debridements or limb salvage. So I think it's a great program in terms of academia. I think limb salvage. And honestly, even though it's been really busy, I'm on call tonight actually, but it's also been very rewarding, and it's been amazing to work with everybody here.
That's great. It is really a who's who in podiatric medicine, especially when it comes to limb salvage. I mean, I can go back 30 years, and Dr. Freiberg's book, The High Risk Foot and Diabetes Mellitus, I mean, we carried that in our bag everywhere we went. So yeah, you're at a great program that with just a historical background with limb salvage. So that's awesome. So if I'm a prospective student and I want to go to the VA Albuquerque or Beth Israel Deaconess, what recommendations are you giving to students when they come there to clerk? What are the qualities of a clerk that you look for when to become a resident at your facility? Shalvi.
Yeah, I mean, I think, what time are you showing up? So definitely show up early. Be prepared if we're asking, we have cases and we'll tell you what cases we have coming up. Did you read up on it? Do you know kind of those common questions? So we're very big on Crozier, questions that come from Crozier, really being well-versed in the information that's in PRISM. So we're a pretty academic program. We have academics every Tuesday afternoon. We have radiology rounds every Friday morning. We do grand rounds with the attendings that run the Foot and Ankle Surgery Academy website that provides a lot of videos. So if you have access to those videos, if you do come to our program, all the residents have free access to that. That has been a huge asset. So me being a visual learner, did you look at the steps of that surgery? Do you kind of know common questions, common pitfalls? So how prepared are you coming in? How willing are you to help? We also are very heavy as far as clinic goes. So we give the students their own room. And that's something that I really liked when I externed here. You get your own room, you bring your own patient in, you interview that patient, you write the note, you go present that patient to the attending. So you feel like you're very in charge of your patient's care, and they want to know kind of what your thought process is. So, just coming here and showing up and being prepared and showing interest. So it's okay if you don't know the answer, but did you go back and look it up, and do you want to talk more about it? Sometimes we ask questions and then we forget what questions we asked, but the fact that you come up to us and say, hey, I looked it up and this is what I found, that shows initiative. That shows that you actually care and that you want to take part in the care of this patient and in your education. And I think that goes a really long way, because then later on you might get to do a little bit more. And so all of that really helps. So
yeah, I think engagement is so obvious, right? And all those soft skills you talk about, paying attention, being on time, all these skills that lead to getting along and working as a team are so crucial, because really, if you think about it, when students are coming out of the colleges of podiatric medicine, the skill set is pretty standard in terms of knowledge. And it's really the work ethics that you see that really make a difference for the residents and the clerkships. So I agree with you. Rahul, what are you looking for when a student comes through Beth Israel? What are you looking for in terms of thinking about bringing them on as a 3-year resident?
Yeah, for sure. I can't speak for the rest of my residents here, but for me personally, if you're rotating here, I'm assuming that you have good grades. I don't care if you have a 4.0, you're here, and so is everybody else. Academically, I understand you're strong. I think you nailed that. I'm looking for the soft skills. I want to see how you interact with my patients, or how you interact in clinic, how prepared you are for surgery. Are you just standing around, or are you, getting into the surgery? Are you being helpful? Did you read up on the surgery? And like Shalvi said, even if I don't remember if I asked you something, do you come up to me and let me know about something that I asked you the day before? A lot of little things that students don't think we see. we see a lot of things. We see how you interact with your co-extern. Even if you had a bad co-extern, how do you manage that? Because you may have a bad co-resident and you have to spend 3 years with them, right? How do you manage this? How do you kind of determine when to go to your superior or conflict resolution? That's a huge part of this residency, right? Because your residency is a very stressful 3 years, and you're going to be stuck with that co-intern, co-resident for 3 years or so, and you have to be able to resolve any conflicts that you bring up. So I think that's another thing I'm looking at. And honestly, I just want someone that I can spend the next couple of years with, and that's not going to drive me crazy. Someone I can go grab a beer with maybe, and just have a good time, because it's stressful and you need someone that you can rely on for sure.
And I think it's important. I know Shalvi dropped off. Hopefully she'll be coming back. Maybe she's on call too, Rahul. I'm not sure. But I think it's important for the students to realize that just as bad as the students want to match with a phenomenal program, the best programs want to match with great students. And it's that work ethic, it's that knowledge, it's that passion, it's the engagement. All of those things are huge in making a difference for programs choosing their residents.
No, for sure. For me personally, I notice when a student is 1 minute late, because what if you're a minute or two late for your surgery, right? Because that's pretty important. We have to be there to pre-op the patient, make sure the consent's signed, make sure the room is set up. We kind of rely on our students to help set up the room, because between cases, we maybe have 15, 20 minutes to send medications to the pharmacy, consent the patient, mark the patient, and pre-op, maybe even see a consult between cases. So we rely heavily on our students at times to help set up the room and make sure everything kind of goes smoothly. And I notice when a student is proactive and, without me telling them, hey, can you go prepare the room? They're already there. They've got everything ready. The local's drawn, the bump is ready, the lights are set, the music's playing. I think that's always a huge plus from what I kind of want to see from a student. And honestly, we've been pretty lucky to have a lot of great students rotate with us. And I'm excited for our next intern class.
Oh, that's great. So Rahul, let's fast forward a few years. I'm hoping Shalvi joins us again. But what kind of music are you going to be playing in the OR when you're in attending?
Well, anything but country. I was talking to Dr. Din about this the other day too, but for me, I can do from anything from classical music to hard rock. I think that helps me kind of suture a little bit faster, and the scrub techs know this too, and the circulator know this too, so they'll play whatever I want so we can get out of there and get to the next case.
I always tell our students that the better you are at suturing, the more work you're going to get to do.
Honestly, I tell my students that, hey, I don't know how well you suture until you kind of suture, right? So if you want to suture, ask me. I'll let you throw some simples, mattresses, whatever you want. And that will kind of tell me how comfortable you are with the needle. And then I'll trust you a little bit more and I'll let you do more. Beth Israel I was able to do a toe amputation as a student at Beth Israel. On my last week there. So if you show the initiative, if you think you're comfortable and you show me that you're comfortable and confident, anything's possible.
Absolutely. No, I'm with you. Do you have Shalvi's phone number? You want to text her and see if she's struggling to get back
Her
on?
phone died, but she's logging back in.
Oh, she is. Okay, good. So while she's logging back on, I really want to talk to you about this entrepreneurial venture that you and Shalvi jumped into called PodMed Adventure.
For sure.
Can you give me a little background on that? Because it was your idea, correct, Rahul?
It was not my idea. I cannot take credit for this. It was Shalvi's idea and her friend Mana, who started this. I think the first year, like you said, to kind of advocate for the field. Try to reach out to prospective students to make sure the field of podiatry is well known. And I actually joined midway through in my third or fourth year, kind of as like to help communicate with different people, try to bring guests on for our Sunday Go Lives that we used to have when we were students, where we would kind of pick an attending or someone across the country to come talk for like an hour or so, like we are now, over on Instagram, and have people ask questions or interact with them. So for me, I think PodMed Adventures was a really great addition to the field, just to kind of bring awareness to the field, especially right now, when I feel like some of the schools are lagging behind on admissions, and trying to get if we can get the word out about podiatry and how amazing it is and what we can do in this field, I think that'd be amazing. And I'm glad Shalvi hopped back on, because I think she deserves to speak a little bit more about this, because this is her baby.
Sure. No, not a problem. And I'm just impressed, because when I think about students, hey, Shalvi, welcome back.
Hello. Sorry about that.
No, you're good. Welcome back. Shalvi, we started diving into PodMed adventure stories.
Technical difficulties.
No,
Okay. Sorry, what was that?
I said we started talking about the PodMed adventure.
Oh, yeah. My
So-
favorite part.
What's that?
That is my favorite part.
I know it. Are you able to get on the video, or are we gonna go just audio?
I think it will be audio for now,
All right, that sounds good.
if that's okay.
That's fine. Shalvi, Rahul's giving you all the credit for PodMed Adventure, coming up with the idea, and what an incredible idea. And I admire the fact that you put this all together while you were a student, with all the other stress associated with podiatric medical school.
Oh, well, it was a team effort. So when I first started it, it was something that I had going, but I think the vision was a lot bigger and I needed help. And Rahul was a key piece in kind of bringing that onto a larger platform and extending that. So, I think he brought together the sports med avenue of it that really brought in more interest. But the goal in starting the page to begin with was when people were trying to ask me more about what is podiatric medicine and how much can you really do with the ankle, there wasn't really a lot of information or resources that were out there. And I know myself, when I was trying to learn more about what's out there were a couple of internship programs that you could do if you're a prospective podiatric applicant. So I know Temple had one and SMU-CPM did have a program. And I actually did go through the Temple winter internship program, and that also helped to kind of solidify this route for me. But there was nothing that really talked about what actually happens when you're in school. Once I got into school, there didn't really know questions to ask or what resources were available unless you spoke to upperclassmen or you spoke to your classmates or you spoke to someone else who knew about that information. And it kind of goes back to the whole.
Yeah, you're going in and out a little bit there, Shalvi. Yeah, we have a bad connection, Shalvi. I'm gonna turn it back over to Rahul, because I think you're kind of talking the same language here. What's your future vision for PodMed Adventure?
I think we started off building our website. I think driving more viewers and everybody over to the website, a bigger platform, because not everybody has Instagram. We started off on Instagram just because it was a little bit easier to kind of display more graphics, right, and video and everything like that. But having the website up and running a little bit more efficiently after we have a little bit more time will be a nice little hub to kind of have resources for a lot of students. Like Shalvi was saying, a lot of it's word to mouth, right? I learned about podiatry from a friend. When you Google podiatry back in 2018, you didn't get much. There's not that many hits. You see the application portal. That's about it. And so I think it's important for us to kind of have this website up and running so that more people can kind of come to this website. And I think you're doing an amazing job with this podcast as well, so that, people can hear from current residents, chiefs to intern year students as well, because I think it's important to kind of highlight our field a little bit more. I think we do a lot of great things in here, and there's a lot of misconceptions about podiatry, right? And then coming in, even my parents had some misconceptions about podiatry. They didn't know what it was. When you're in Europe, actually, podiatrists don't do surgery in Europe. So a lot of people that are international, when you tell them you're a podiatrist, they're like, oh, you're just clipping nails. But we do so much more than that, right? We take care of diabetic patients. We save their limbs. We do Charcot recon. We do trauma, ankle fractures, flat foot recon, cavus recon. So people are actually amazed once they start seeing all our post-ops, pre-ops, everything like that, and kind of being able to display all of these cases and our experience through the field. I think that's what our vision is. And I think obviously when residency started, we get busy. We didn't understand how busy residency can get. And obviously with the change in time zones, it gets even more difficult. So I think once we have a little bit more stability in our residency lives, we might be a little bit more active and hopefully get some more people to see our page and learn about podiatry.
No, that's great. PodMed Adventure has a good vibe to it. I've got Dean's Chat. What can you say? So a couple of things I wanted to mention, Rahul, and I think that it's important that leaders in the profession, future leaders in the profession like yourself, are aware of. So we all recognize that there's a student recruitment issue, and a lot of it is for the very reasons you just eloquently stated, right? There's not a lot of information out there. So the American Association of Colleges of Podiatric Medicine, and currently your dean, Dr. Stamps, is the chair. I'm the vice chair. We just approved a whole student recruitment initiative, and it's aimed towards blanketing the country, 220 colleges between the 11 schools, talking about podiatric medicine and what it's about. And like you said, there's misconceptions, but really podiatric medicine's come a long way over the years, and it's really unfortunate that not enough students know about it. So I would like to say, we would love to reach out to PodMed Adventures and work together and drive students towards your webpage. So even after this podcast, I'd really like the opportunity to chat more about how we can work together.
Oh, definitely. I think we should definitely get on that. And I'm glad that American College of Pediatric Medicine is actually having this initiative, because you're right. We have to drive recruitment a little bit more and kind of get the word out to people. I think during COVID, we had a little lull. I think that's where we kind of were kind of pushed to the corner a little bit. So now that we have a little bit less restriction, hopefully people can see how amazing this field is and come join us, because we definitely need a lot more people in podiatry. There's it's expected to diabetics is expected to increase over the next 20 years, and the complications of diabetes are managed a lot by podiatrists. So we need more.
Yep, absolutely. So I think that's great. And we'll talk more about that, but I really appreciate and really it's a tremendous effort that you and Shalvi have put out, and I congratulate you for that. Rahul, if I was a prospective student and I was looking at podiatric medicine, what would you tell them?
Well, I think I would tell them, hey, what are you interested in? Are you interested in surgery? Are you ready to kind of deal with the 3 a.m. neck fash call? Because there's a lot to podiatry than just, diabetic wound care or diabetic routine care, right? We are, depending on what program you're at, depending on what practice you're at, you're either doing high trauma or high limb salvage, high sports medicine. So I think the field of podiatry, it's very wide. You can do anything from non-surgical diabetic routine care to sports medicine, work with ortho groups with ortho trauma, take their trauma call, or, be an academic institution and start doing limb salvage. So it's really about what they're interested in. I think the field of podiatry has something that everybody can be interested in. And if surgery is something that you want to do and you want to have a good quality of life, I think podiatry is for you. Our residency is 3 years long, as opposed to maybe a 5-year ortho residency with another year of fellowship or something like that. We also have the option to do a fellowship if you feel like you want a little bit extra training that you didn't get during residency. Obviously, if you go to a high power residency, maybe like Beth Israel, you feel pretty comfortable doing almost everything once you're done with residency. So going to a fellowship is not really needed. But it depends on the individual. If they want to get an extra year of training to feel a little bit more confident and get back into the job market, I think that's also an option. So I think podiatry is a pretty wide field and has a lot to offer to the prospective medical student.
Well said. So Rahul, we'll start to wind it down a little bit. I wanted to ask you what you do to relax. You're so busy. I look at all the research you're doing, and I know what it's like to be a resident. What do you do to kind of relax and recharge the battery?
What is relaxing? I don't know what that word means. No, I think one thing I would say to anybody going to enter residency in the next month is that you're not going to have a lot of time off, but in the time that you do have off, take advantage of it. Definitely find one hobby that you're really passionate about, one or two, and get to it. Maybe your program has you taking call for the first 6 months. You don't have that much time off, but in that little time that you do have off, take some time to yourself. Don't worry about the pager. Don't worry about work. Don't worry about research. Don't worry about your patients. Just calm down. If you want to watch a movie, watch a movie. For me personally, I like to work out. I like getting into the gym. That's my place to meditate. That's my place to find my zen. When I started residency, one of my chief residents, Juan, he's an excellent golfer. So he got me into golfing. I got my used set of golf clubs and I hit the range with them every weekend, just to kind of get my stress out. So being able to do something like that, I think that's what I do in terms of trying to relax. And then some days I don't want to do anything and I just sleep in. I think that's also important because, hey, we're in a sleep deficit most of the time, especially if you're taking call, you wake up at 4 and you still have to get to work at 6 a.m. after you do a neck fash overnight. You got to get your sleep in. So if you feel like you want to sleep in for the weekend, don't feel guilty. Just do it because it's a tough job. And I think a lot of residents, myself included, feel guilty when I take a day off. Like on Saturday, I was just hanging out on the couch watching TV and I was like, I should do something. I should finish my something. And I was like, what am I doing? I should just relax. So that's what I do. And that's my advice to the residents coming in July.
I think that's great advice. So Rahul, I wanted to thank you for joining us today, and B, let you know I'm looking forward to following your career. You've got a lot of energy, and I think you're going to make a difference in our profession. Same with Shalvi. I know Shalvi's fell off and she's not with us right now, but I also thank her. So thank you for your time.
Thank you.
Oh, you're back. All right. Hi, Shalvi.
I know. I keep cutting in and out. I don't know what's going on, but yes, thank you for having us.
You're very welcome.
Thank you so much, Dr. Jensen. This was amazing. Dr. Rosenblum had nothing but high praises for you, and I'm glad he wasn't wrong about anything. It was a great time, and maybe in the future we can get back on another call.
I look forward to that. So to all of our listeners, I thank you for joining us on Dean's Chat today. We will continue to bring you the leaders and voices in podiatric medicine. And like today, the future leaders in podiatric medicine. Shalvi and Rahul, I'm going to be sending you a Dean's Chat cup. I think you'll use that, and because I know you're going to be drinking coffee to stay awake and grueling schedule. And but I do look forward to talking to you more about PodMed Adventures. I really want to talk to you more about that and see how we can work together. And until we can do another podcast again, cheers, everybody. Bye-bye now.